Yeah, of course. I mean, you want a drug that works, but you want it to be durable. And so we just presented the durability results today. So if you look at the 12-month observed complete response rate, that was 45.9%. And so what does that number mean? It means all comers that were treated, you can tell your patients in a year, you've got about a 50% chance that you're going to not only respond, but you're going to respond at that, you're going to be a responder at that 12-month mark. There's other ways that we look at durability. And so if you look at the patients that responded, about 53% of those responses lasted for at least a year. So if you're a responder, you have a very good chance of responding over a year. And then they did some Kaplan-Meier estimates where they tried to predict what this would look like in 24 months, in 2 years. And it looks like the curve flattens. So like at the 12-month mark, the curve flattens so that, looks like the people that are responding at the 12-month mark will probably be responders at the 24-month mark. I think it's a great question. Right now, the standard of care for this disease is radical cystectomy, but I would argue that maybe we should rethink that approach. I think that these new drugs that are coming out, and especially TAR-200, I think are the standard of care now. And you can see that patients are definitely motivated. 95.6% of those patients on the TAR-200 monotherapy arm, they were patients that were eligible for a cystectomy but declined cystectomy because, who wouldn't want to try to save their bladder? And the results are so good now, with this drug particularly, that I think it's, I think it's reasonable. I think to offer this patients, and you can see that from a safety standpoint. So we want to look at, are these patients progressing, on treatment? And so if these patients responded to treatment, there was a really low rate of patients needing cystectomy. So the 12-month cystectomy-free rate was 86.6%. And there were only about, it was 5.7% of patients that progressed to muscle disease. So rare patients that are progressing, it's safe and it's tolerable. And we can talk about, ease of use and that kind of stuff, practical things later. But, from a patient standpoint, I think that this is really exciting data. And to answer your question about a paradigm shift, I really do think it is a paradigm shift. I think we're potentially going to change the standard of care in this disease. And not only that, we're doing it in a different way than we've done it in the past. We've never really placed devices in the bladder that can deliver sustained release drug. What we have right now, we have a lot of therapies that are intravesical, where you put a catheter in and then the patient can hold the solution for 1 to 2 hours at most. But we're talking about a device that allows us to give pretty good doses of drug over 7 days at least. So I think the first thing we look at are AEs, and it's a pretty favorable AE profile. So most of the AEs are grade 1 or 2 AEs. These are the typical dysuria, frequency, urgency, the bladder symptoms that patients usually experience with any of these intravesical therapies. One thing that was cool to see was that there was a 99% success rate, insertion success rate. So urologists were doing a pretty good job, deploying these devices in the bladder. And there was only 3 patients that discontinued treatment due to AEs, and there were no deaths. So, overall, this is a safe drug. So when you're counseling a patient, you can be confident to say, look, this is a safe drug, and there are going to be some AEs, but when you give patients the option, you're going to have some dysuria, some frequency, some hematuria, or you can have your bladder removed. I think every single patient is going to say, give me the dysuria. So I think the AEs are favorable, and patients are willing to undergo some of those symptoms because they're very motivated to save their bladders. The good thing is we have a lot more options now. And if 5 years ago, we didn't have any of these drugs available. And so it's a good problem to have. And now as urologists, we're gonna have to start figuring out like when to use these drugs, in what sequence do we use these drugs. But TAR-200 has some favorable outcomes, and some favorable logistical, considerations to think about. So the complete response rate of 82.4%, that's the highest reported to date, So it's a drug that really does work. And what people found out today was these responses are actually durable too. And so you can give these to patients and you can say, look, most people are gonna respond to this medicine, and likely your response is gonna last for at least a year. So that's something that's cool. So that's one thing that differentiates from the rest of the group, is that it does have a very, very high response rate. It does have a different mechanism of action. I mean, it's a chemotherapy. It's not an immunotherapy. So it's a cytotoxic agent, and so it works differently. And it's a completely different way of administering the drug. So urologists, I think, are a little bit more involved in the procedure. It's a placement catheter, and you deploy this this device into the bladder, and then at 3 weeks you do a cystoscopy and you remove it just like you would remove a stent. So urologists are a little bit more involved, but a lot of my patients that are coming to see me from a couple hours away are happy that they only have to see me every 3 weeks. In that first treatment phase, it's 3 weeks for the first 24 weeks, and then after that it becomes every 12 weeks till week 96 based on the trial. So you see the patients less. The other one logistical consideration is that it comes packaged in like a paper packaging. So it's very easy to deliver. You don't need any special processing. You don't need a pharmacist to mix the drug. You don't need a hood or a freezer. You basically just store it at room temperature in your drawer. And so you can have these available in your clinic. If the patient shows up, that's great. If they don't show up, you didn't waste any drug. And so logistically it can be, also helpful.